My name is Kara Noskoff, and I am the AY Program Coordinator at CHOP Children's Hospital in Orange County. I started working with the adolescent and young adult population in 2014, where it was very important to me to sit at the bedside and just listen. There was nothing I could say or do that was going to fix the situation, and I needed to absorb all that I could to understand what the experience was. I sat and I listened and I watched. I listened as these teens and young adults shared about the loss of independence, the loss of their freedom, the privacy, watching their friends and families move on. I had countless patients that moved away for the first time to school, only to be met with a cancer diagnosis, having to move back home, their parent or their sibling sleeping in their hospital room, and losing their identity, their body image was changing, their freedom, that taste of freedom was so quickly taken away from them. It became my mission to support them and to meet them in that moment and to help them find a hope for their future and to see beyond cancer and what was going to be next for them. They endured countless chemotherapy treatments, radiation, surgery, but the isolation is what they speak of the most. It's a lonely, isolating feeling to be in this situation where your peers that are moving on and doing school and starting their dream jobs and dating, and they're scrolling from their hospital beds and watching it all unfold in front of them. Teens and young adults should be dating, they should be going off to school, they should be starting their dream jobs, falling in love, gaining that independence, but instead a cancer diagnosis impedes that normal development. AYA, as we've shared, is adolescent and young adults. There's close to 90,000 diagnosed per year in the US. And what happens is we have a health system that's divided into two. We have pediatric hospitals and we have adult hospitals. So this age group has been identified as 15 to 39. And that number came from data several years ago where we were seeing approval in survival rates in pediatric patients, and we were seeing approval in survival in adult patients. But this 15 to 39-year-old age gap, we weren't seeing any progress. And that gap is attributed to a few different things. One, the two separate health systems where you have pediatrics and you have adult, but we're not really focused on this age group in the middle, and we're not providing age-appropriate care. So you're either the oldest patient at a pediatric hospital or you're the youngest at an adult hospital, and the clinicians don't quite know how to care for you clinically or psychosocially. We also don't understand fully the biology of our bodies and the changes that are happening between 15 to 39, and so we haven't caught up in research. We have unique psychosocial needs. There's a lot that's happening, and so the impact on your mental health during that time is very challenging and kind of impacts the compliance that our young adults face when they have to undergo a lot of treatment and give up their freedom. We also see a lot of delayed diagnosis, and so when you're busy and you're a teen or you're a young adult, you're playing sports, you kind of just dust it off your shoulders. I'm fine, I'm young, there's no way that it's cancer. Doctors often will tell you you're too young, there's no way it's cancer, only to find out months later that it is cancer and they haven't started treatment right away. So there's several reasons, but those are some of the top ones. We have seen huge progress over the years, but we have a long ways to go. And as someone who's worked in the health system for many years now, I know that hospitals cannot meet the needs of this age group. We've learned that AYAs need access to clinical trials. Oftentimes they're cut off at 18, and we need them to be accessible to all young adults. We need age-appropriate care at both pediatric and adult oncology centers, and so we need these hospitals to start working together so that we can create comprehensive programs that meet the unique needs of this age group. AYAs need to know about their fertility rights. They need access to the right mental health resources. They need clinicians that are willing to talk to them about their sexual health, about pain management, helping them transition from on therapy to off therapy into survivorship. It was mentioned earlier so beautifully that transition from going on therapy to off therapy is oftentimes the most challenging piece. You've lost your sense of self, you don't look the same, you don't feel the same. It's similar to someone that's just gone to war. And how do you rehabilitate afterwards? How do you get back into school, back into work, dating, and getting back into this new normal when you just endured trauma and a life-changing event? And then we think about the supporters. What do you say? What do you do? How do you continue to be there as your life is continuing to move on? And that's where incredible organizations like Be Present come in. I cannot do my job, I cannot care for my patients and their families without incredible organizations like Be Present. We rely on our community because a hospital can only provide so much support. We're so focused on the clinical side and curing the cancer and getting these patients back into that new normal, and that's where we have to rely on our community partners. So today, as we kick off AWA Awareness Week, I'm so encouraged by all of you being here today. This is a world that I live in because I've chosen this career and I've become so passionate about these patients and survivors and their families. But seeing you all show up today and join me in that passion, I'm so encouraged and inspired for what's to come for this age group. I've watched countless patients and families and friends choose to have joy, choose to have a hope for their future, and choose to create change, but it takes a village. And today we get to be a part of that village. As you listen to patients' stories today, I hope that you're impacted not only by the adversity that they faced, but their resilience and their strength to overcome. Today, as we walk a mile in their shoes, let's hold hope for those currently battling this disease, the ones we've lost and miss wholeheartedly, and for the ones to come. Today we get to choose to be better and do more. Thank you so much.